Good afternoon. Thank you. I know I'm standing in between you and lunch, so I will be respectful of that. But I just wanted to tell you, I am very excited and honored to be here with you today. I know many of you have traveled from all over the world and from all over the continent to be here. But I'm going to ask if you will travel with me again. I'm going to take you to a place that everyone can see, but no one goes to. A place everyone can see, but no one goes to. I hope you like riddles. Okay, so while you're thinking about that, actually, can I just get can I use that mic? While you're thinking about that, I want to know who is in the room today. Let's do a quick conference census before we go on this trip. Just a show of hands, how many of you are coming to AHILA for the first time? Wow. Everybody else, keep your hands up. No, keep your hands up. Everybody else, I want you to wave to them. Welcome them into the family. Okay. Has anybody come to AHILA more than once, maybe twice? Is this your second time? Please raise your hand. Wow. You came twice. You were hooked. Has anybody been here 4 or more times? 3, 4, 5, 6. Whoa. Madam President, I think they need frequent flyer miles. I ask you this because if you think about it, everyone in this room has a vast experience of knowledge. And if we collect all that knowledge, it's probably a couple of decades worth of information right here. And everybody here is in your network now. I have been thinking, we're in dark times. We all survived a global pandemic. And now countries, instead of embracing collective action, many nations are retreating into isolationism. Science is being dismissed. And the institutions that are funded to collectively safeguard our collective knowledge are being defunded. So I've been asking myself, I've been looking for a moment of hope. And when I think back to times in humanity when we have pooled our collective knowledge, when we have broadened our imagination, when we have mustered the courage, one moment comes to mind, and that is the space race. So remember that riddle? The place that we can all see, but no one can go. In fact, there was a hint right here on the board, staring at you. We are going to space. We're going to the moon. Let's go back to the 1950s. We're in the middle of the Cold War, and the world is gripped by the space race. And when you think about space, you might think about astronauts in white suits, engineers at mission control. But there's a group of people that without them, space was never going to happen. Librarians and information specialists. Seriously. They were creating the architecture of knowledge. They were creating data repositories for patents, for millions of technical reports. They were selecting and curating the failures as well as the successes of every launch. When you put a person into space, you need to know what works and what doesn't. NASA repositories were disseminating knowledge across disciplines as well as across borders, even during the political tensions of the Cold War. So, because people like you stood, space became a possibility. So, we're ready to go? 5, 4, 3, 2, 1. Yeah, we did it. We made it to the moon. Yeah. I want us to come back to Earth, and we're going to see some familiar faces. I give you this example of librarianship because I want you to know that librarians don't play a secondary role to scientists. You don't just get papers. You are mission critical. And medical librarians specifically, you make discovery, innovation, and our very survival possible. This talk is about going beyond access and how libraries can transform health information inequities. But first, we have to talk about inequities. So I want you to imagine this. A doctor and an epidemiologist come into your library and they tell you there is a suspected outbreak of bubonic plague. So you go online and you start searching for an article that they need to diagnose this strain of plague. You find the article, but it's stuck behind a paywall. So you put in your Hinari access code. But you find that this article is still not accessible, and there's no way your institution is going to pay the outrageous subscription fees. What do you do? God forbid this information is in a book. I heard you say interlibrary loan. What happens if that book is at Makerere University? I saw a sign here that said proud Makererian, so this one is for you. How fast can you get that book? How fast can you ship it in? Is it an allowable research cost? This is unfair, but beyond being unfair, it is life and death. We are in an outbreak. What do we do? This is actually a true story. This is a true story. I'm a field epidemiologist, and I have investigated an outbreak of plague here in Zambia. And to be honest, we had to rely on colleagues in the US, whether it's the CDC, because for them, accessing a piece of paper is just a click. I want us to think about what that actually means for Africa's ability to conduct a systematic review. If you remember, during COVID, the headlines would say, Africa, COVID has missed Africa. Africa is unscathed. How do you know? I have worked here in health systems, and anybody who has lived in Zambia, if you have a death in the community, it is very difficult for you to get the cause of death on a death report. And actually, when researchers triangulated the data of postmortem and seroprevalence surveys, seroprevalence surveys, as well as the WHO excess mortality, they actually found that people had seriously underestimated the burden of COVID in Africa. And everything I've been talking to you about has largely been about papers. And we know that there is a hierarchy where peer-reviewed papers that are written in English are kind of at the top of importance. But if knowledge is power, then who decides what counts as knowledge? I gave a TEDx talk in Lusaka, and I asked that same question. Who do we consider our experts, our knowers, And how do we deem which knowledge is credible or worthy? Who controls the means in which we produce that knowledge? What happens to knowledge that is encoded in symbols, that is published in cloth? What about published in wood? BBC Africa ran this story this year with the Women's History Museum in Zambia, and they actually found a hunter's toolbox with sonar writing systems, a mathematical writing system that was transmitted into wood carvings. That's pretty cool, isn't it? Yeah. If we only value what is indexed in PubMed or Web of Science, we will continue to make the same mistakes that colonialism did in sidelining Africa's history as well as its knowledge that is transmitted through oral history, through symbols, through different media, and even songs. I have a confession to make. These are not the slides that I was going to show you. About 36 hours before this talk, I sat down with one of my friends. She's a PhD graduate from UNZA. And I said to her, okay, I need to give some solutions. So there's this open access thing that's happening in Germany, and it's going to be a backup for PubMed when it goes down. And I think African institutions should be involved in the creation of this because it's open source. She asked me a question that left me speechless. She said to me, Ramya, what would a solution look like if it didn't involve America and Europe? What would the solution look like if it didn't involve adapting a system that was made for America or Europe? So, I'm talking to you about getting rid of these knowledge hierarchies, and I need to also honor the expertise that is in this room. I'm not going to tell you the solution. Let's try something. Take 30 seconds and talk to your neighbor. I just want you to ask them, what is one truly African solution you would imagine for medical librarianship? Don't worry about the funder. Please, don't overthink it. Just take space. This is all about space. Take some space to imagine. 30 seconds.
They'll take us far if we just collaborate and share experiences.
I like that was a co-created answer that you co-answered. Does anybody else? We have time for one more. I saw some very intense conversation here.
Thank you very much for that question. We think that if institutions in Africa could develop their own database that is indigenous to Africa. Let me tell you an example. If University of Zambia libraries have a repository, the University of Ibadan have a repository, Makerere have a repository, and we have a federated search system where I can search for articles from the University of Zambia, and Christine can search articles published by faculties in the University of Ibadan. And I could do so with her from Cape Town. 60 or 50% of our article needs will be solved. Thank you.
Thank you so much. Thank you. African databases and solutions. I love it. That's great. My timer is going off. I want to leave you with a couple closing thoughts. I'd like you to continue that question, that answers to those questions. I'd like you to talk about it at lunch, and I'd also like you to think about it at every session that you go to today, as well as tomorrow. And maybe tomorrow you meet up with the same people at lunch and you see if anything has changed. Some closing thoughts. What we've been doing here at AHILA is dreaming about the future, our possibilities. And that is a big picture feeling. I have goosebumps right now, which is why I want to show you one of the most famous photos in the 21st century. Wow, that's breathtaking. Astronauts spend their whole lives training for space. That place we see, but nobody goes. And when they got there, they looked back and they described a feeling, a phenomenon called the overview effect. The overview effect. The borders of your nations have disappeared, and all that is left is one fragile planet. And the only way to survive is through cooperation and mutual solidarity. That is what has built the International Space Station. That's the spirit of the International Space Station. Think about it. 15 countries have put in $150 billion into the International Space Station, and no one owns it. No one owns the space station. Any discoveries, any knowledge generated on the ISS is for the benefit of all humanity. So to me, the ISS gives me hope that knowledge without borders is possible. And all of you in here are the custodians of our knowledge. Please keep on dreaming, keep connecting, keep networking, keep collaborating, and I want you to keep thinking about a better future for all of us. Thank you. I have 2 slides left. This is just fun, especially if you're Zambian, because if you remember the Zambian astronauts in the 70s, Zambians were training for space and simulating space launches in rockets. And it's funny, except that it's also amazing, the imagination and thought. And Victor has written a piece about just imagining, like you, what it would be like to be the first African to step on the moon. So this is a fun thing if you'd like to read. It's a great read. And the last thing I have for you is if you'd like a copy of the slides, if you'd like to tell me if I did good, if you'd like to tell me I did bad, please just go straight to lunch. But if you'd like to give me any feedback, please scan this code. I'd love to hear what you think. Thank you, everybody. Thank you, AHILA. Let's go.
Thank you very much. What a presentation. In the background, someone was asking, why didn't you give us at least some background? We wanted to raise your appetite so that you get more about Dr. Kumar. As you've seen, we have information there. We scan the QR code in case you want to get more about her. Let's go ahead, sorry. Yeah, in case you want to get that more information from there, you can just copy that or get more information about who Dr. Kumar is. But before we break for lunch,